Hello and a very warm welcome to New Age Parenting. All over the world, childbirth is considered as a divine blessing. At times, when a couple gets married or plan to have a child, actually before that they want to know each other, and that is why they delay the process. Until the time it's with their own consent, it's fine. But then there are times when they are planning and the gift is not coming. That is the time when they start getting disheartened. But with the new technologies and with assisted pregnancy procedures available, it is becoming a blessing. Hope is there for every couple, and that is why we have this series where we are talking about all these procedures. So once again, today we would be talking in detail about all these procedures which can help a couple to enjoy the blessing of a baby. Time now for an open soul searching. In our soul searching segment today, we have the privilege to have Dr. Nandita Palshetka, who is the leading infertility expert of India and has 20 years of experience. A very warm welcome to you, Dr. Nandita.
Thank you.
What we want to talk about is about these assisted pregnancy procedures. What are these procedures basically?
The simplest treatment that we first start with any patient in an ART lab is IUI. The full form of IUI is, intrauterine insemination. Now, in this particular technique, what we do is we give the girl some hormonal injections so that she produces 1 to 3 eggs only. We don't want more eggs in this patient, okay? Then this girl goes for an ultrasound and sonography monitoring is done, and we see this growth of this egg. Once the egg is ready, normally the egg grows about 1 to 2 millimeters per day. So when it is about 19-20 millimeters in size, that is the time we give an injection called the trigger, and we allow this egg to rupture in the body.
Okay.
So see, intrauterine insemination is just a step away from natural. Okay, so once the trigger is given, normally what we time the rupture, that means 36 to 40 hours after the trigger, the egg will rupture. So what we do is at that point, between 36 to 40 hours, we call her into the hospital. Then we ask the husband to give us the sample, the semen sample. Then the semen sample is actually processed in such a way that, we feed the sperm, we improve their motility, and that way we harvest the best sperms, which are the best motile sperms. And then these are actually gently deposited into the uterus.
Okay.
So then the sperms and the eggs, we hope, will meet in the fallopian tube and the fertilization will occur there, like what normally occurs. So this is intrauterine insemination. This is one of the simplest techniques. And there are certain things that are necessary before you can do this. Like the fallopian tubes have to be open because we deposit the sperms in the uterus. Okay, and then she has to be able to produce eggs. So we give medicines to produce eggs. So these are some of the things, and the sperm count. The sperm count is also important. If it's a very, very low sperm count, then this technology gives a very poor result. The success rate actually of this technology is only 10 to 15% per attempt, So this again, technology is a repeated technology. You've done one IUI, a lot of patients come to me and they say, oh, we've done one IUI and it's negative and we're very depressed. But that's not the situation, it's 10 to 15%. So you must do this IUI at least 2 to 4 times, I would say.
To see the results.
Yeah, and if the girl is younger than 35 years, 4 attempts is fine. But age again, plays a really important part.
This is actually a little bit of assistance, to have a natural process actually.
Exactly.
To create that feeling of it's a natural baby.
Absolutely.
But the things you've talked about, that the sperm count has to be good, the egg production should be there, and then the
tubes have to be normal.
Should be open.
So you're saying which patient does it really fit?
Yes, because these are the few things which actually, as a layman, I may not be knowing before they go for any procedure. I think these things need to be rectified, any of these things, even the sperm count, even the production of eggs or the opening of fallopian tubes. What are the procedures for these three treatments? What are the 3 treatments?
You know what, the treatments actually, if an infertile couple comes, it's divided into medical treatment, surgical treatment, and the ART or the reproductive technologies, IVF, XC, etc. So when we talk about medical treatment can be utilized for the male factor. If the sperm count is low, we have medicines and other things, injections to help improve. But remember one thing, it's very important to communicate with the patient that this treatment should be tried for 3 months, maximum 6 months, everything depending on the age of the lady. Now if the lady is 35 or 40 plus, then we don't waste time. You understand? So it's better to go aggressively in those patients. Then in the female, medical therapy works in patients of PCOS where they don't produce eggs. Usually, if I have say about 10 patients of polycystic ovary, then 3 of these patients would conceive with simple medicines. We just give drugs to produce eggs. Then the next 3 would conceive with intrauterine insemination, and the next 4 would probably require IVF. So nearly 30 to 40% of the patients would be treated by medicines or surgery. Now, medical therapy is also useful in endometriosis. When we don't want to operate, the disease is not that bad, then we can use medical treatment in those patients also. Now, in the women, the surgical treatment is really helpful. For example, some patients have blocked tubes. So then we go in, there are 2 ways of opening the tubes. One is we can go internally with a telescope into the uterus. That is known as a hysteroscopy. And we actually go in and pass a wire. You know how you do an angioplasty? You pass the wire and then you put the balloon and open the vessel. It's the same principle. We pass in a wire through the uterus into the tube and then open up that balloon and see if we can inflate it and open that tube. Now, simple blocks, mucus plugs, etc. can be opened by this technique. This technique is also done under X-ray. So you don't have to undergo a surgery. But these are all blocks only at the corneal end, as we say. Now, if the block is further, when we do an X-ray, we find out that the block is at the terminal end of that tube. Then we have to do a laparoscopy. If it's tuberculosis causing the block, then the surgery for repair of the tubes becomes really not very meaningful.
The blockage of fallopian tubes is a result of tuberculosis, usually? Infection?
Yeah. The whole tube gets damaged internally.
Oh, okay.
See, the egg doesn't have any movement of its own. It's actually picked up by the tube. And inside the tube there are these cilias, like kind of I don't know how to describe them, like how the fish have these movements, they move with the fins. So this movement actually pushes the egg towards the uterus.
It helps the
egg. So even if the tube is open, if it's not functioning, then the egg just doesn't move. And very often in these patients of infection, we have ectopic pregnancy, where the egg is fertilized, but it doesn't move from the tube into the uterus, and it grows in the tube. And then that can be a very dangerous situation.
A lot of more things which we need to talk. So I have an email. There's a lady who is around 28, and she says that I haven't got my partner and I'm really wanting to work more because I'm doing my research and I want to continue more with my passion, the work. And I want to get married, but sometime later in my life. And what I want to know is that whether I'll be able to conceive when I'm around 35, because I do want to have kids. And are there procedures which will tell me that, I'll be able to have babies, and will they be normal? Because a lot of myths are around, a lot of these talks. And of course, the way Indians are, we keep on talking about actually having these late pregnancies and the defects which can be there. So, can this procedure help this lady?
I think this girl is really woken up early. 28 is a fabulous age to be really thinking about all these things. As I said, there is a new technology called egg banking. What we do here in this patients is that we can actually store a woman's egg, and they can be stored for years, and then later on used to have a baby.
No, if she's 28 and now you can store her eggs?
No, we generally 35 is a cutoff kind of. After 35 the fertility rates start dropping. So we normally tell the girls that between 33 and 35, if you've not found a partner or you're delaying, your marriage due to any reason, or even delaying childbirth, if you're married and found a partner, then it's great to, create the embryos. If you're married, you can create the embryos itself, with your husband's sperm. But if you're unmarried, you can just take out your eggs Now this egg reserve, as I told you, can be determined by this test called anti-Mullerian hormone, a serum AMH. It's just a blood. So now if this 28-year-old has a AMH which is really low, say 1, then I would advise her, please go and freeze your eggs now. So it's not 35. You understand?
Okay.
We would assess her.
Even if you want to go for a childbirth at 35, these eggs which you'll freeze now will be helpful.
They will be 28-year-old eggs. Remember that.
Okay.
When we use them, say we use them 7 years down the line, those eggs are 28 years old. So whatever defects and whatever you talk about is in a 28-year-old girl. Whereas if a woman tries to conceive naturally at the age of 40, her eggs are 40 years old. So the chances of mental retardation, etc., becomes 1 in 200.
Amazing. This looks like a miracle. I would like to know about the downside of it, because it must be having some downsides. Because this is great. I'm like, all the problems can be sorted out actually.
See, yeah, as you said, everything looks very rosy.
Yes.
But yeah, but there is a success rate.
Yeah.
You know, initially when egg banking, egg freezing was started, you needed 20 eggs to give 1 pregnancy.
Okay.
You know, you needed to store. But now with the technology improving, there's vitrification, that number has become half.
Okay.
But what we need is, yeah, we need to give this girl hormones. We need to produce 10 to 15 eggs and then retrieve them and store them. You know, so that is the downside. And it can happen that she may give less eggs or may give lots of eggs. That
and then
is hyperstimulation.
again, it all depends upon the egg storage which she has.
Absolutely.
You know, because each being will have a different storage. Okay,
Totally.
amazing. I'm saying, like, we can understand that, you know, your human body is a miracle. But then the way, this is what we've been talking in this show, that science and spirituality are finally coming together, you know, and creating something which is
it's fantastic.
Miraculous.
But you know, till now, till today, till this egg banking is being offered, these girls unfortunately had to go for egg donation. So you had to borrow eggs from a younger girl, you know, with a good egg source, and then use the husband's sperms and try and get her pregnant. So today the opportunity, in fact, we've had a lot of patients from the glamour industry, from the, you know, the lawyers, the different girls who are in business, they've come and they've stored their eggs with us.
And how expensive is this treatment?
Anything between, I think it would be about 50,000 to 60,000 is the storing fee, and the IVF cycle, whatever the cost would be, depending on the number of injections that she needed.
Okay, so then she'll have to actually go for IVF.
Yeah.
Then when the time comes that they can
Then we would do IVF or ICSI to create the baby and then transplant the embryo
let
into a
it
womb.
sink in. You know, it is taking time to sink in, because I think a lot of people out there, because this is something which a lot of people are not aware. Dr. Nandita, let's talk about IVF now, the coveted IVF. Till now, a lot of people, a lot of calls I got, a lot of emails I've got, where they say, is the baby born in the test tube? You know, because a test tube baby. So what is the reality of IVF?
You know, I had one couple who came and asked me, how will you put us in the test tube? Actually, test tube baby, this technology was first invented in 1978 by Edwards and Steptoe. In fact, Bob Edwards, as we call him, Robert Edwards, got the Nobel Prize in 2010 for his work done in the 1970s. And it was a real breakthrough work because you were creating life outside the body. So in this procedure, what actually happens is the fertilization, which I told you happens in the fallopian tube. We perform the fertilization outside the body.
In a tube.
In a
Which
dish.
acts like fallopian
In a
tube.
dish.
Okay.
Okay, it's not even a tube. It's a dish. I don't know where this word test tube has come from, but it's in a dish. And actually, so in the dish, what you need is you need eggs and you need sperms. Okay, sperms are easy to get. You ask the husband to produce the sample, and you take the sperms. They are of course processed the way I told you in IUI, and those sperms are used. The egg retrieval is a little bit more invasive procedure. Okay, I'll explain how it is done. So normally when the girl gets a period, on day 2 of her period, we start giving her hormonal injections. She takes these injections every day for the next 10 days.
Okay, and it's a very painful procedure.
No, it is not. In fact, it's become very patient friendly now.
Okay.
All these injections are actually like, you know, those insulin syringes. and the amount of injection is like in microliters.
Okay.
So it's supposed to be absolutely painless. I can't say any injection is painless, but injection becomes painful when the needle is bigger, when the amount that is injected into the body is larger. So with this concept, they've really made them painless. You know, it's like as thin as your hair.
Okay.
And the material is so microscopic, it's like a dot. So she takes these injections. Along with the injections, the girl has to come to the hospital for ultrasound.
Okay.
And we do an ultrasound on day 2 of a cycle, day 6, day 8 and day 10. Normally by the day 10 she's ready, and this time we give a trigger which is at 16-17 mm size eggs, and usually we see that we are looking at anywhere between 5 to 15 eggs. I mean, that is the ideal number. Okay, so once we see the eggs and they've reached a certain size which is more than maybe 17 mm, then we give this trigger, and now we don't allow the eggs to rupture in the body.
Okay, you pick it up earlier.
Yes, we go in with a needle and a suction attached to it.
Okay.
We look at ultrasound because the ultrasound guides us where to go, and the eggs are actually sucked out. So you know how you take out blood from your veins? It's like that. We go into the ovary and suck out the eggs from the ovary.
Okay.
So it's absolutely a 10 to 15 minutes procedure. We go through the vagina with a needle. So there's no cut, there's no stitch, nothing. The patient wakes up on table after 20 minutes, and after 2 hours she actually goes home.
Okay, she's able to.
Yeah, but of course anesthesia is involved because there is pain. You know, some people do it without anesthesia, but there is pain. So this is the procedure. Now these eggs are then transferred into the laboratory where the process of IVF begins. So we take the eggs, we take the sperms, and we create the baby outside the body.
Okay.
So these eggs are cleaned, kept in a dish, and 1 lakh sperms are put in a dish containing 3 eggs.
Okay.
Okay, now here again, IVF is more or less natural. In the sense, the best sperms go and fertilize the egg. Okay, and an embryo is formed. So this is what is the process of IVF. Then after 2 days, we check, okay, we have beautiful embryos, day 2 or day 3 or day 5. And we take these embryos and we deposit them gently into the uterus. Okay, now we cannot grow the baby outside for more than 5 days. There's no technology as yet.
Okay.
So maximum we can grow them is day 2, day 3 or day 5, that's it. Then they die in the culture because the requirements become more complex and the research has not yet reached that level.
Okay, so then that is the time, you know, when actually the embryo gets implanted, and that is when the divine comes in, you know, that whether it'll convert into a baby or not.
Yeah, I think that is an important part because at this point there are a lot of questions in the mind of the patient. Should I take bed rest? Should I just lie in bed, or should I eat this? You know, what are the do's and don'ts? So normally after an IVF, after the embryo transfer has been done, we tell the patients that 3 to 4 days she should be on house arrest, not on bed rest. Bed rest is actually not required. I personally feel a lot of mental stress is bad. So she needs, you know, to be comfortable, at peace, comfortable and occupied. Maybe do a little bit of housework like cooking or something just to divert her mind, or sit and watch TV. You know, she need not be flat. Absolutely, it's an absolutely wrong concept.
And maybe, you know, invite the soul to come and be a part of, you know, maybe, you know, like spiritually make it happen, basically.
Absolutely.
It's a spiritual process, you know. Otherwise also, if we look at it, childbirth is basically another birth for women, and I think for the male also, for the husband also, for the father also. Dr. Nandita, in fact, it's so interesting. We just got so involved in it that I didn't realize we don't have much time, but we would be wanting to talk to you in the coming episode. So thank you so much for today and giving us this much time. Thanks. This is IVF for you. These are assisted pregnancy procedures which are possible. There are many more possibilities, but if you have any questions, if you want to know more about these things, please feel free to give us a call or you can email us. So till the time we meet again, enjoy parenting.